PRN medications. PRN is an acronym for the Latin word pro re nata. This translates to as needed. The medications that are taken on a PRN basis do not follow a routine daily regimen. They are not given at the same time every day, but they are given when needed, such as Tylenol for fever, albuterol, an inhaler for shortness of breath, Advil for pain or arthritis, aspirin for headaches, nitroglycerin for chest pains, maybe the Tums for heartburn, or even Ativan for anxiety. Remember, just because they're over-the-counter does not mean they could not have a side effect with a prescription drug. So you want to check with the pharmacy when you give the doctor's orders for that over-the-counter. Now let's look at the PRN medication record. The PRN medications are not listed on the MAR. They have their own sheet. On this sheet, you want to make sure you document the date that it was given, the time, what medication, the dose, the route, and definitely your initials. When giving this medication, you must give the reason why you're giving the medication. You want to check back in 30 minutes for the results. You must document the time that you checked. Go back 30 minutes later if nothing has changed. Make sure you initial this document. Before you can give any over-the-counter medication, please remember you must have a doctor's order for that medication. Medication, including without limitation, over-the-counter medications, or dietary supplements, must be plainly labeled as to its content. The name of the resident for whom it is prescribed and the name of the prescribing physician must be on the label. You must keep it in its original container until it is administered. Applying a label or a piece of tape to the dietary supplement or over-the-counter medications with the resident's name and the physician's name is acceptable. The facility may purchase commonly used over-the-counter medication for use by multiple residents if the over-the-counter type and the amount meets the physician's orders for each resident, and the over-the-counter is labeled with each resident's name and physician's name.